But we made it from New York to Texas in one piece. And I got set up with the Department of Rehabilitative Services, who would help with funding. But there was a gap for 4 to 5 months. And we had been told of a window of rapid recovery in the first 1 to 2 years, depending on the therapist I talked to. Either way, I didn't have 4 or 5 months to throw away. So we needed to triage which therapies were most important. Now, walking was pretty important, so physical therapy was on that list. In fact, the kind of therapy I did was aquatic therapy. I had to relearn how to coordinate everything. Like a toddler relearning how to walk. The thing is, a toddler doesn't have that far to fall. As an adult relearning how to walk, it's important to have a safety net, and the water made for an excellent net. Now, my mom insisted on vision therapy, and I did not see it as a priority. Really? Not even a gasp from a room full of optometrists? So I'll have to wear glasses for the rest of my life. Big deal. It's not like nobody else has to do that. And my mom basically hushed me and followed her instincts, and boy, were her instincts right. I don't need to tell you this, but there's an intimate relationship between the eye and the brain. So this is what I see without glasses. Take a look at that. Don't take your eyes off. Just stare at that for a while. It's hard, right? Nah? Nah. And it's hard for visual and psychological reasons. Your brain's constantly making predictions. So when it sees double, the ocular motor reflex kicks in to orient your gaze to see single. But it doesn't work with this picture because there actually are 4 eyes, right? So it kind of hurts your brain. All right, I'm going to take her away, but you can get an idea of how potent visual stimuli is to the brain and attention. Along with brain fog, this has a doubling effect. And yes, pun intended. Ha ha. Vision therapy was one of the therapies that fueled my interest in the brain plasticity, neural pathways, and neurorehabilitation. So I want to thank the vision therapy community for making information available to patients like me through blogs and videos. I especially like this one by Dr. Leonard Press, where he calls me the Sue Berry of acquired brain injury. So here's a diagram of the 12 cranial nerves and the parts of the body that they innervate. Let's zoom in on the 4 that directly innervate the eye. So as you know, that's cranial nerve 2, 3, 4, and 6. Now the second cranial nerve receives information from the retina and passes it on to the other cranial nerves to affect the direction of gaze, the position of the eyelids, or the size of the pupils. So imagine when you first wake up, say the first thing you see is a dot on your ceiling. For a brief moment, you're going to see 2 dots, one for each eye. And immediately that information will be relayed and your gaze will be adjusted to bring those together so you see the 1 dot that's actually there. That doesn't happen for me because my 4th cranial nerve is partially paralyzed. Now the 4th cranial nerve innervates the superior oblique. This muscle rotates the eye outward and down. So the automatic pathway to correct gaze based on visual stimuli for me is partially paralyzed.
Someone take me to a doctor, then take me to a church. Someone take me to a doctor, just take away this curse. Someone take me to a doctor. Someone take me to the hearse.